afternoon, everyone. Thanks for joining us today. So we'll start with an update. Since the media advisory yesterday, we have 2 new cases of COVID-19 in our province. Both are males between 20 and 39 years of age in the Eastern Health Region. One is related to international travel, and the source of the second is under investigation at this time. Total number of cases in our province is 400. There have been no new recoveries since yesterday, leaving 5 active cases in our province. In total, we have tested 78,749 people. As of yesterday, the province had received 16,500 doses of vaccine, both Pfizer and Moderna, and over 10,000 doses have been administered. We have entered the time period where the Pfizer shipments will be delayed, and as the quantity and duration of the delay is uncertain, regional health authorities are holding Pfizer vaccine to ensure that we have availability to administer second doses. The timing of this delay is unfortunate. There are new variants of COVID-19 circulating across the globe, at least 2 of which have been identified in Canada. A variant means that the virus has mutated or changed in some way. The variant that was first identified in the United Kingdom, known as B.1.1.7, is one that is more easily transmitted between individuals. And while the vaccine protects against this strain of the virus, this variant moves faster and easier. COVID-19 variants are transmitted in the same way as the original strain, through droplets. And this means that the public health measures we have been practicing all year will protect against COVID variants, just as it protects against other respiratory illnesses, such as influenza. Remember the layers of protection. Wear a non-medical mask in indoor public spaces and ensure it covers the nose, mouth, and chin. Wash your hands regularly and wash them well, or use hand sanitizer. Keep your close, consistent contacts to 20 or less. Maintain at least 6 feet of physical distancing from people who are not your close contacts, and stay home if you are sick. Also, if you've not received the flu shot already, there is still time to do so. Our key concern has always been importation of the COVID virus through travel. Generally speaking, we have had good compliance with self-isolation requirements and adherence to public health guidance. It is because of this that we have fared so well. Our good fortune, however, can be quickly upended if we do not remain vigilant. Over the past month, we have stepped up our follow-up with travelers to ensure that they are aware of and complying with self-isolation requirements. All individuals must declare their self-isolation plan and contact information before they are permitted entry into the province. Public health officials make contact with all travelers in self-isolation. If there is no response after several attempts by phone and email, law enforcement will be contacted. Please note that if you are a traveler in self-isolation, our call may show up as an unknown number on caller ID. If your contact information should change, please notify exemption requests at gov.nl.ca as soon as possible with your updated contact information. I want to thank the officials stationed at airports, ferries, and land borders. These individuals screen travelers as they arrive to ensure that their purpose for entering Newfoundland and Labrador is essential, and that they have a plan to self-isolate. Together, you form a critical layer of protection against the importation of COVID-19. While travel into our province has been limited to only essential reasons since May, it is an important reminder to everyone that all non-essential travel in or out of the province should be avoided at this time. For those who have essential travel to the province, I want to take a moment to remind people that we have an electronic travel form in place that must be completed prior to coming into the province. Filling the form out in advance of your travel helps public health to understand who is coming into the province, and it makes it easier for us to contact you if required. All travelers should submit the electronic travel form within 30 days of your expected travel date. We have been following the situation in Saint-Pierre-et-Miquelon over the last several days. Officials from the Department of Health and Community Services and Eastern Health have met with officials from Saint-Pierre-et-Miquelon as recently as this morning. St. Pierre and Miquelon have completed extensive contact tracing and testing and have the situation well in hand. They have agreed to send only those patients whose visits are deemed essential for care, and all infection prevention and control protocols are being followed. Any individuals from St. Pierre and Miquelon who come to Newfoundland and Labrador are required to isolate, except to attend the medical appointment with enhanced protocols. We will be meeting with officials in St. Pierre and Miquelon regularly as the situation evolves, and we'd like to thank them for their collaboration and cooperation. Last week, we asked passengers who travelled on the MV Blue Patties to or from North Sydney and Port aux Basques between December 29th and January 16th to arrange for COVID testing. To date, we have not identified any positive cases associated with that situation beyond the 2 cases identified. As a recap, for those who may have just joined us, we have 2 new cases since yesterday's media advisory, and the total number of cases in the province is 400. The COVID-19 pandemic has been a rapidly changing situation from the beginning, and it will continue to evolve for some time to come. What hasn't changed is how we've kept this virus at bay. We have proven we have the tools, ability, and determination to do this. Let's maintain our momentum. Hold fast, Newfoundland and Labrador. Thank you. And I'll now turn it over to Leslie to lead media questions. Thanks.
Thank you, Dr. Fitzgerald. There are 5 reporters registered for today's call. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, we're seeing the UK and the South African variants in Alberta. How concerned are you that we could end up with cases of those here, considering that there is still a fair amount of movement back and forth with Alberta? And are you considering changing any of the rules around quarantine for rotational workers, for example, because this strain is more transmissible?
So we certainly are watching that situation carefully and watching it evolve. At the moment, certainly we're not seeing large numbers in Alberta, and they're certainly quite aware of the situation as well, and are taking measures to help reduce the spread of those variants. So we will be watching the situation closely, and as we've been saying from the beginning, if the evidence changes and the epidemiology changes, then we'll change our response.
With new positive cases that we're seeing, are we running the genetic testing on it to tell whether or not any of these new cases are of either the UK or the South African strain?
Yes, so our cases are being sent for what we call whole genome sequencing, so that will tell us if they are any of these variants of concern.
Thanks.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dentists are asking where they stand on the vaccine priority list. They're concerned that they're not included with healthcare professionals in the vaccination program, considering that they're doctors too, and they're looking into the mouths of patients. Just wondering where they stand on the vaccine priority list.
So we are certainly working through phase 2 and those priority lists right now, and we will be notifying any associations, of their position in that, but I certainly wouldn't want to speak prematurely about it at this time.
And Moderna has been approved for up to 6 weeks between doses. That's according to WHO. Are we looking to implement this, or are we okay still running with the recommended, I believe it's 28 days between?
Yes, so the recommendation is still that we stick as close to the, that the original manufacturer's recommendation of 28 days be adhered to as much as possible. The National Advisory Committee on Immunizations said that if there is a situation, whether that's local epidemiology or some other reason, why that interval would have to be expanded, then up to 42 days is acceptable, and preferably that the second dose should be given within that period of time. So we are sticking as close as possible to the original manufacturer's recommendations.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you, Dr. Fitzgerald. We're a few weeks away now from Valentine's Day, and we know that some schools have already issued advisories about Valentine's Day. Do you have any directives on how the exchange of Valentines could be handled in the province's schools this year?
So we've had our hands a little bit full, so Valentine's Day hasn't been up there on the priority list, but certainly I think we can look at how that can be done safely, and we know that the virus doesn't live for extended periods of time on cardboard and paper products and things, so I'm sure there's a way that this can be done safely, and we'll get some guidance up on our website.
Thank you. And in regards to a situation a couple of days ago, what kind of communication have you had with the RNC regarding the man charged with the breaking of rules of self-isolation, and how concerned are you to hear that something like this even happened?
Well, it is concerning to hear that someone is not adhering to self-isolation protocols, but I feel like the system, once it was discovered, the system worked, and we know that. So I personally haven't had any interactions with the RNC or RCMP about this case. They would have contacted regional public health authorities who would be looking at the isolation requirements and that sort of thing with this person and follow up with this person. So, this just underscores the importance of everybody doing, what they're following the guidance that's in place.
Thank you.
Our next questions are from Elizabeth Witt with All Newfoundland Labrador. Please go ahead.
Thank you. NQO Research just released a poll showing Atlantic Canadians' interest has dropped getting vaccinated since the spring. So we're going into January. So what's your response to those results and how will the government increase confidence in vaccination?
Well, certainly, I think when we're in a situation where we have low case counts and things, people maybe think they don't have as much to worry about and that they may want to wait. But I think what people need to understand is that this vaccine is safe. It's been approved through the same rigorous protocols that all vaccines have been approved through, the two that are available right now. And if you are identified as being in one of those priority groups that we want to have protected early, so if you're in those congregate living facilities for seniors, or you're the identified as those frontline healthcare staff and other priority groups, then we certainly would recommend that you get the vaccine, and both are considered quite effective and they're both quite safe.
Right. And this poll also doesn't break down how Newfoundland and Labrador fared against other provinces. And I think in previous briefings you've said that, historically, Newfoundland and Labrador has had a higher uptake of vaccination. So do you expect this trend to still take hold with COVID-19 vaccines?
Yes, certainly we know that in our childhood vaccinations, we absolutely have done quite well. We're in excess of 90% for all childhood vaccinations. And that's, a stellar performance really as a province. And in H1N1, we had quite high uptake as well. So we would expect that the uptake would be the same throughout this province for COVID vaccines.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Sorry about that. There are people at the moment who are starting to think about festivals and other events towards the end of the year. For example, the George Street Festival, the Gata, the Folk Festival all happen in August. What advice can you give them?
So right now, our advice is that these public health measures still have to stay in place. We are still learning about what the effect that this virus will have on the transmission of, this vaccine will have on the transmission of the virus from person to person. And so until we have more information about that, we really can't make the recommendations to remove those public health measures. We also don't know what our situation will be from an epidemiologic point of view at that time. So, it's very difficult to make those predictions at this point.
Okay. And we've heard of at least two instances now where store managers and staff have steadfastly refused to allow exceptions to mask wearing, even when a clear medical reason was given. Can you clarify again what, if anything, your office says with regard to mask exceptions?
So, I will start by saying there are very few medical reasons not to wear a mask, but there are some. And so we have said that, we have outlined the exemptions or exceptions for mask wearing in the special measures order. And if somebody isn't able to wear a mask, certainly we ask that people respect that decision. However, we have seen the effect that wearing a mask can have. I really think that mask wearing has reduced potential spread of the virus in several situations now where we have had, some community spread of the virus. So I think that the power of the mask has been shown just in our own province, and it's been shown elsewhere in the world as well. So we certainly would say that anybody who is able to wear a mask should wear the mask.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
Yes, Dr. Fitzgerald, you mentioned that as of, I guess, about a month ago, there's now follow-up with travelers when they... I'm wondering if you can give me an idea, why was this change made, and what percentage, or do you have any numbers on how many people aren't responding to those calls and have had been forwarded on to law enforcement?
So we made the change just enhancing our whole procedure, the whole travel process. We're trying to make it more streamlined. So, we introduced the electronic form, and then after that, we just had an easier way of being able to contact people, and so to be able to follow them up. So we tried to enhance that follow-up at that time. So it was just more as a result of the streamlining of the travel process, really, so with regard to the numbers that I'm sure we have that information, Peter, but I don't have it to hand, so we'll have to get that for you.
Okay, thanks.
Kellyanne Roberts with NTV, do you have a final question?
I do. Dr. Fitzgerald, at the beginning of the briefing, you noted that the call for follow-up or for contact tracing might be a number that's unfamiliar or come up as a block caller. With all the scams going around, is there not a better system we could use so people can identify the number?
So at this time, that's where we are. I think my understanding is that they are working on some process that would improve that, but at the moment, it may come up unknown number.
Thank you.
Richard Duggan with BOCM, do you have a final question?
Yes, I do. Dr. Fitzgerald, one person has been in hospital for quite some time now with the virus. I was just wondering, how long have they been in hospital, and wondering if you can comment on, I guess, the extent of their condition.
No, I can't really comment on any of that, sorry, for privacy reasons.
Thank you.
Elizabeth Whitten with All Newfoundland Labrador, do you have a final question?
Yes, I do. I'm looking for an update on the vaccine committee. 3 ministers sit on it, and the government is currently in caretaker mode. So is the committee still meeting regularly and making decisions?
So we met just before the election was called, and we haven't met since. But all that work is still ongoing. The officials in the Department of Health and in public health are certainly carrying out all the duties that need to happen to make sure that the vaccine is getting distributed as it needs to be. So all of that work is still ongoing.
Thank you.
Peter Jackson with the Telegram, do you have a final question?
Yes, I do, thanks. I wanted to ask your opinion on a commentary in the Canadian Medical Association Journal recently that recommends the vaccine be given to pregnant and breastfeeding women as a matter of ethics. Do you consider that to be a reasonable argument?
So certainly what we have said is that anyone who is pregnant or breastfeeding, that they have a conversation with their primary care provider or their health care provider. And then after that, certainly if they want to have the vaccine based on that, then that's something that can happen. So we've not excluded people who are breastfeeding or pregnant from getting the vaccine. We just, we don't have the evidence at this point because these people weren't included in the trials to really make a an outright recommendation, or at least the National Advisory Committee on Immunization. So it's we're not saying don't, we're just saying make an informed decision.
Thank you.
Thank you, everyone. Dr. Fitzgerald, do you have any final comments for today?
No, just thanks to everyone for joining us, and take care, stay safe, and we'll see you next week.
Thank you, Dr. Fitzgerald. Take care, everyone. Stay safe and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID